Right. Hello, everyone, and welcome. Thank you for attending Health Justice, Engaging Critical Perspectives in Health Law and Policy. My name is Rakaya Yerby, and I am a professor of law and member of the Center for Health Law Studies at St. Louis University School of Law. I'm also co-founder and executive director of the Institute for Healing Justice and Equity. The Petrie-Flom Center is delighted to partner with the American University Washington College of Law Health Law and Policy Program, the Institute for Healing Justice and Equity, the Satcher Health Leadership Institute at Morehouse School of Medicine, and ChangeLab Solutions to bring you this event, which is part of the Health Justice Engaging Critical Perspectives in Health Law and Policy initiative. The initiative began with a series of virtual workshops and conferences in the summer and fall of 2020. It's continuing in 2021 with a blog symposium we launched this week in today's webinar. And in 2022, we will be publishing a symposium issue of the Journal of Law, Medicine, and Ethics, co-edited with Professors Emily Benford, Brietta Clark, Seema Mohapatra, and the both of us. Myself and Lindsay Wiley, who I will turn it over to.
Thank you, Rakaya. I'm Lindsay Wiley. I'm a professor of law and director of the Health Law and Policy Program at American University Washington College of Law. Before we get into the discussion, just a few housekeeping items. We are not going to have a series of presentations today. Instead, it's going to be an interactive discussion and sort of an ongoing Q&A that Rakaya and I will host. As part of that, we strongly happily invite questions to be submitted through the Q&A feature by participants. And it's wonderful to see some familiar names on our participant list. Thanks so much for joining us. If you have a question, submit it anytime, and Rakaya or I will integrate it into our discussion with our panelists as we go along, rather than saving the Q&A for the end. You can submit those questions using the Zoom Q&A feature. The chat feature has been disabled, so please use the Q&A feature to share your questions with us, and we'll be keeping an eye on that. You're also welcome to join the conversation or submit questions on Twitter using the hashtag Health Justice. Again, that's Health Justice is the hashtag that we're going to be using today. Feel free to submit a question that way as well, and we'll be keeping an eye on Twitter so that you can join the conversation through a couple of different means. Let's see, ways you should not try to submit a question. Using the raise hand feature. We will not be monitoring that feature on Zoom. And again, we've turned off the chat function as well. If you're interested in this event and interested in other health policy, bioethics, biotechnology topics, we strongly encourage you to sign up for the Petrie-Flom Center newsletter and to read their blog, The Bill of Health, which features some really cutting edge commentary by legal scholars, including our panelists for today's event and the symposium on health justice that we are launching with this event.
And I would like to now introduce our panelists. So first we have Dr. Charlene Galarno, who is a senior lecturer on global health and social medicine at Harvard Medical School and associate professor emerita of Wesley College's Women's and Gender Studies Department. Her 2016 book, Communities of Health Care Justice, presents a concept of community justice that understands multiple and diverse communities as critical moral participants in determining the nature of justice in U.S. healthcare. Professor Angela Harris is a distinguished professor of law at UC Davis School of Law. She writes widely in the field of critical legal theory, examining how law sometimes reinforces and sometimes challenges subordination on the basis of race, gender, sexuality, class, and other dimensions of power and identity. Asha Pamaku leads the policy fund of the Partnership for the Bay's Future at the San Francisco Bay Foundation. Her work at the foundation addresses the interconnected challenges of housing, transportation, and economic opportunity. She also serves on the boards of the Asian Pacific Environmental Network and Baby Friendly USA, Inc. Together, Angela and Asha published an article last year in the UCL Law Review titled The Civil Rights of Health, a new approach to challenging structural inequality, applying a health justice framework to examine subordination as a major driver of health disparities. And last but not least, Dr. Jamila Michener is an associate professor in the Department of Government and co-director of the Center for Health Equity at Cornell University. Her 2018 book, Fragmented Democracy, Medicaid Federalism and Unequal Politics, examines how Medicaid, the nation's public health insurance program for people with low income, affects democratic citizenship. And I apologize if I mispronounced anyone's name. I'm sure, and please do correct me as we go through this wonderful discussion. I'll turn it over to Lindsay.
And I know from personal experience, Rakaya has lots of experiences with mispronunciation of her name. I often have people reach out to me because we work together saying, how does Rakaya pronounce her name? So let's talk about health justice. We framed our blog symposium around 4 central questions that we invited our contributors to respond to in whatever way they saw fit. What does health justice mean to you? What role does it play in your work? How does health justice relate to other frameworks for advocacy, teaching, research, and scholarship? And how should the community be involved in efforts to realize health justice?
So to start us off, I'd like to invite all of our panelists to reflect on the meaning of health justice. Is it different than health equity? Is health justice similar and or the same as social justice and equality? And anyone can jump in.
I'm happy to jump in and start us off. I love the provocation to focus on health justice. And I think of health justice as kind of connected to health equity, but broader than health equity. And I think of health justice as a feature of one of several features of social justice more broadly, right? So we can't have social justice without health justice. And we can't have health justice without health equity. And so those concepts are distinct, and they're sort of embedded at different levels, but they're connected. The approach that I took to when you all sort of asked those questions and you really pushed us to articulate how we think about and understand health justice, I always, when I'm facing a kind of concept and grappling with the concept, my temptation is to go in a very academic direction and start like quibbling over definitions and like what are the contours of the thing, and be very analytical. And one of the things I consistently push myself to do is to stop, turn down the volume a little on the analytical thinking, not that it totally disappears, but just turn down the volume a bit and connect to what really matters. Why do I care about this? Why do I study it? Why does it matter in the world for me and for other people? And that's what led me to what is unusual for me, but what I find what I found a little bit refreshing and compelling, which was to focus on love. And I thought about Cornel West's statement that justice is what love looks like in public. And it was just a rendition of justice that resonated because it connects with the kind of deep values that draw me to thinking about health justice and health equity and social justice. And those values are about a belief I have in everyone's inherent dignity as a person, and in everyone's, based on that dignity, set of resources, access, and more that they should have. And we all sort of want that, but we all definitely want it for the people that we love, right? And if we could take what we want for our children, for our loved ones, for the people who are closest to our heart, and think about ways to amplify that across the kind of public, both in a domestic sense, within national borders, and even beyond that, right? If we think about the public as humankind. Now, that sounds really like pie in the sky. And so in the piece, I really wanted to both take like a big abstract, but very real to us value like love and connect it to this work and to this conversation, but then ground it by also connecting it to power. And we can have these goals for how we want to see love enacted more broadly and how we want to see it enacted through the channels of health justice. but without making sure that people who are otherwise marginalized or who are going to lack the resources that we would want them to have in a context where love was really the core of our motivation, how are those people going to have power so that they're able to have a say in bringing about the world that is implied when you say justice is what love looks like in public? And so that's just a little bit about what sorts of things came to mind for me when I started to really sit down and think carefully about how I understood health justice.
Jamila, I love that so much, because one of the things that I was thinking about as you were talking was the embodied nature of justice and kind of the heady nature of equity, right? I think, you know, we see that folks are hitting the streets and they're putting their bodies in danger, not necessarily in the name of equity, but in the name of justice. So there's something very physical, very embodied about the notion of justice that really compels folks and really puts it into modern actionable language that is motivating people, motivating movements. So I think that's really important. And that's the other thing that it really brought to mind for me is I think health equity sits very comfortably in the public health realm. But health justice, I think, is an invitation to a broader participation of other disciplines. And I think even more importantly than other professionalized disciplines, it invites the participation of social movements for justice. And so it brings the activists, the folks on the streets, the folks on the front lines into contact with academia, you know, with the folks who are doing the research and who are in more professionalized spaces. So it's that interactivity that is also very embodied, as you were saying, Jamila, that I think is really critical. And just the last thing that I'll note that it brings to mind for me is justice, I think, inevitably really invokes law and policy as tools that will get us to where we need to go. So I think it's that combination of, you know, urgency, the embodied nature of the work, and then also that very interdisciplinary mixing of fields and folks who might not otherwise be in dialogue. So to me, health justice has an urgency and an invitation that I think health equity lacks.
I'll jump on there. When I think about health equity, one thing, well, actually, let me start with health justice. When I think about health justice, I think what is important for me to acknowledge is just how many different notions of justice there are, that there isn't one, right? And what that's part of the problem, I think, particularly often with the philosophical theories of justice, is there's this assumption of justice as being homogeneous across an entire nation, for example, and rarely does it reach global. And where I've really come into this is around the community part, is recognizing that communities have different meanings and values, including different notions of justice. And so for me, health justice has something to do with respecting those values and meanings that different communities have. And in our process of health justice, both sort of theoretically making space conceptually for communities to have a place, but also in our work on the ground, communities not only as implementers of health justice, but also definers of health justice. And so that's really a lot of what I think. And Aisha, when you talk about embodiedness, I think of that as embodied in communities, certainly in individuals as well, but also deeply embodied in communities.
Yeah, I love what everybody has said about this, and I don't really know what I can add. I love the idea of connecting love and power as two kind of motivating factors as we have these discussions, because Jamila, I was really moved by that notion that part of why all of this is important to us is the sense of the desire for the people that we care about to flourish. And health is about flourishing at all kinds of levels. But at the same time, in order to allow that flourishing in a very unequal world, we do have to think about the institutions that we function through and the ways in which those have been really deformed by legacies of injustice. So that that tension, which can also be a convergence, as you're saying, this idea that justice is what love looks like in public, I think is really motivating health justice for me. And for me, I'm coming through into this discussion not from a health place. And so the idea of health equity was really kind of unfamiliar to me and kind of struck me as a technical term. Like this is health equity is something that we can measure in terms of, how many people are getting access to healthcare, or what the statistics look like in different populations in terms of morbidity and mortality. Whereas for me, coming from different, more law-oriented background, justice, as others have said, is the word that gives me that sense of invitation, that sense of struggle, that sense of transformation.
So Angela, I have some very specific ideas about what you can add to this conversation, and I just want to ask a follow-up question. There's a growing literature about what it means to frame a scholarly or advocacy or combination of the two movement in terms of ex-justice. And you've written some really compelling work on that. So I'd love to invite you to say a little more about how health justice fits in with other movements. And Jamila put this really well in saying that, health justice is a part of, but not exhaustive of social justice. Just wanted to invite you to say a little more about that.
Yeah, sure. So I came into health justice really from environmental justice. So when I was just starting out as a law teacher, I got involved in the environmental justice movement from a friend of mine, Luke Cole, who is the founder of the Center for Race and Poverty in Central California. And so with my background is really thinking about as a critical race feminist, we had a lot of discussions about, well, what is the legacy of racial domination and gender domination in terms of our built environment, in terms of people's bodies, and in terms of health. So environmental justice was kind of the first framework I was familiar with. And in teaching environmental justice, I then got involved in food justice because a lot of my students were really interested in food systems. And similarly, how food systems have been shaped by a legacy of colonialism, and how we might restructure food systems to be more human-centered, and to better kind of promote human flourishing. So kind of along this path, I realized that there's this whole series of justice movements that have popped up, especially in recent decades. So we have not only environmental justice and food justice, but there's reproductive justice, there's land justice, there's water justice, there's data justice. And so I wrote an article a couple of years ago in the Canadian Journal of Women in the Law that tried to talk about all of these justice movements together and figure out what links them all. And I think one of the things that links them is this really holistic concern for flourishing, which is where I think health justice comes in and another convergence point. And all of these movements also, I think, are very aware of the limitations of professional discourses like law or like public health, because all of them are really centering inequality and the vulnerability, the silencing of frontline communities that have been receiving or the targets of subordination for quite a long time. And what's crucial to me in all of these justice movements is that we're putting, and I think Charlene alluded to this as well, we're putting the affected communities in the center. And the goal is not to apply our professional knowledge to lift up these vulnerable populations. The goal is to have these vulnerable populations have an equal say and equal ability to affect and participate in the systems that allow them to flourish or not. So it's really this sort of transformational vision that puts the people who are affected at the center that, to me, best typifies a justice movement. So health justice, to me, is different from sort of the outcome of everybody having an equal level of diabetes or something like that, which might be achieved in any number of ways. Health justice is really talking about the ability of the most affected communities, the most subordinated communities, to be able to empower themselves and to be able in turn to check the excesses or the limitations of the professional discourses like law and public health that otherwise might be tempted to or inclined to accommodate in inequality and systemic inequality in particular.
So I'd love to hear a little of the backstory behind your collaboration with Aisha on this project. It's something that's so exciting to me, and in many ways a model for what we're hoping to support through this broader health justice initiative that we've been working on in partnership with other organizations, which is to bring together someone who has been working in critical legal studies and critical race feminism with someone who has been focusing on public health and health equity movements and working with community organizations. And I think it's just such a beautiful collaboration. I'd love to hear a little more about how it came to be and how it's benefited your work to combine forces in the way that you have.
Yeah, let me toss it to Aisha.
Sure. Oh my gosh, Angela, I love hearing you talk about your movement research. It's just so timely and so inspiring. Our collaboration came about through the incredible matchmaking of ChangeLab Solutions and Maris Ash in particular, who really saw an opportunity to bring us together as a public health lawyer and advocate, and then someone who is really leading the way in critical race theory and feminism in academia. And thanks to that incredible and wise matchmaking, Angela and I were able to dig really deep into the strengths and also the limitations of our respective fields, looking at public health and civil rights law. And just as two examples, public health has made many incredible population level strides in some of its ambitious goals. And we've seen that even as we've improved health overall, very stubborn racialized health disparities still persist. We see that with COVID, for example, with the incredibly racialized outcomes of the disease, both in terms of transmission and mortality, and even the economic impacts and some of those more downstream effects. In terms of civil rights, among a number of things, right, we see that sometimes the field gets stuck in a very individualistic conception of what it means to have a racial animus towards a particular group, and it really has to lie within the individual and to be provable in a certain way. And so those were some of the limitations that we were seeing. And we had this light bulb moment where we realized that public health and civil rights law could be not only really fruitful collaborators for each other, but they could help get each other out of their respective stuck points, right? So using those examples, individual intent doesn't matter so much when you have an incredible, powerful mapping of how health disparities move across race and place, right? And civil rights law gives us some incredibly powerful tools to address in a very specific way the racialized health disparities that we're looking at today. So that was one of the origins of our collaboration, but I think it was Angela's background and some of the things that she spoke about that I think really led us to what is today what we're calling the civil rights of health. And it was that she had the insight that getting these two disciplines together was a powerful but incomplete solution. The more complete solution was to bring a third party to the table, and that was justice movements as an equal collaborator amongst the civil rights law folks, amongst the public health folks, and really welcome them to the table as not targets of policy, not targets of charity, but actually co-creators of the solution and of the world of health justice that we want to see. And so that formulation, civil rights law, public health, and social movements for justice, was eventually what became the civil rights of health. And ever since then, I think we've really been digging into what are some of the transformative possibilities of where that can take us. And of course, that has taken us to examine a lot of health justice projects and some of the implications. I'll pause there, but just Angela, if you had anything to add just to our origin story.
No, I think that's beautiful. I always think of the backstory of the origin story is that I had retired from teaching at Davis and was at the Berkeley Y in the before days when we could all exercise in person. And I ran into Maris at the gym. And she was like, "Oh, you've retired. Well, I have a great idea for a partnership." And that was kind of my introduction to the public health world. And then that led to my introduction to Aisha. And as Aisha said, I'm so grateful to Maris for having that foresight to think of, here's a really fruitful conversation that hasn't been happening, but could be happening about what happens if we use civil rights law and public health, research and advocacy, and kind of bring them together, sparked by this desire for empowerment. And it really has turned into this amazing collaboration with Aisha, who I love working with, as well as this incredibly, I think, generative place for thinking about new kinds of advocacy, new kinds of initiatives.
Yes, and what I love about the paper is this identification of the problems with public health law and civil rights law, is that it focuses on the individual, that we don't focus on the community. And I want to follow up with a question for Charlene, of course, because your work focuses really on communities, and the boundaries of health justice communities are contested and should be interrogated. Could you say a little bit more about that and whether the contested nature of community in any way weakens it as a site for health justice?
Great question. Great question. But while we're on origin stories, can I just add a bit? The reason that I got involved in this was not an academic pursuit ever, is that I started out my sort of health career with community health centers, now called FQHCs often, but it was really working in community health centers back when it was very much a social justice movement, late 70s and the 80s, both at the sort of local level, but also statewide collaborations of centers that were serving underserved persons, by and large, underserved communities. I think often people are reluctant to talk about communities because they're kind of messy, right? And often the boundaries are messy, right? And we often want clear, bright lines among communities. And what I really believe is that any boundaries of any social collectivity, whether it's at state level, whether it's national, whether it's community, is going to be messy. And we just don't want to recognize that. I mean, where I am, many people are receiving COVID testing and vaccines across state lines because that is the closest place for them, even though they're technically in this state community. So I think we just need to be clear about what we mean by communities and recognize that there's going to be some blurring of those community boundaries. What I think it doesn't mean is always nation or society. I actually think that we belong to multiple social collectivities, if you will, groups that we identify with, we participate in, that we feel responsible for, that are our communities, that have a whole lot to do with our health and our healthcare. And so we need to be talking about communities. We need to work with communities. We need to think about, I think it was Angela, what you said about institutions being deformed. We need to think about ways that institutions can be created or changed, other ones changed, to enable that community power, that community voice, right? And that participation for communities to really be centered and taken seriously. One of the things about the community health movement that I learned is that this is one policy, one set of programs that has community-based membership. That's the majority on their governing boards. So it isn't just a little bit of community input. They in fact have governing power on boards. And that's one really important piece, I think, that communities need, which is community power building. Yeah.
One of the things I'm really excited about using health justice as a framework for thinking about health law and policy is the opportunity to draw connections between healthcare topics and public health topics and well-being, community well-being more broadly. And so, Charlene, your work does that really beautifully. And it makes sense to me that you started out, very grounded in those federally qualified health centers. I'd love to turn it over to Jamila and invite you to bring Medicaid into the conversation. I love assigning excerpts from your book to my students, and they respond to it with just this incredible energy and excitement. It allows me to start off an academic discussion about something that can seem really dry and boring and technical, with a vivid sense of what is at stake in Medicaid policy. Can you tell us a little bit about how Medicaid affects democratic participation, this idea that Charlene raised as well, and other connections between healthcare programs and political engagement and power building?
Yeah, I appreciate the question, and I appreciate you assigning the book. But I was thinking about this as Charlene was giving the phenomenal comments that she just gave about community, but then sort of looping in power and power building, and talking about the unique structure of community health centers and the kind of baked in institutional structure that said, you know what? We actually are going to create a space for the voice of the people who are most affected to have a role in this institutional space, a role that sort of is carved out from the onset by definition. And that is unfortunately much more of the exception than the rule, right? So most of the times when we think about power or participation, and we think about policies like Medicaid or other kinds of health policies, we're thinking about them very separately. And when I say we, I don't necessarily mean us here on this panel. It sounds like we don't have a kind of undue dichotomy between those things. But when I first started working on the book, I also didn't start out thinking, oh, let me look at the relationship between Medicaid and political participation and democracy. Instead, I wanted to understand what was happening in people's lives. And how, if at all, policy and government mattered, particularly in the lives of people living in and near poverty, and especially folks of color. And so I started to just go into these communities and talk to people. And Medicaid came up again and again without me bringing it up, because I didn't know initially that the work was going to be about that, but it came up. And I thought, wow, this is really important to folks. And so that really blossomed into what was ultimately the book that's focused on Medicaid, but really bubbled up from people saying, this is really what's important to me. But what struck me in those initial conversations was the sense of kind of powerlessness and voicelessness that people expressed relative to their place in a program like Medicaid. And I wanted to understand what sorts of experiences are underlying this and what are the larger implications for democracy. So when I shifted from my initial qualitative foray and I started looking at some quantitative survey data and asking people and analyzing that data to see if there was a relationship between being enrolled in Medicaid and whether you voted, whether you were part of a local, civic or political group, whether you engaged as a kind of member of a democratic polity in any number of ways. And I found this sort of negative relationship. At first, people were like, oh, that connection is preposterous. That's just, it's just because these folks are living in poverty and they're less likely to engage more broadly. And I sort of dug deeper into the kind of statistical end of things. And it was like, this isn't a relationship that goes away, even when I account for a really wide array of things. But then I went back to people and I wanted to talk to them, having now a better sense of what I really wanted to know about. And get a sense of what experiences explained and underlied that relationship that I had found between utilizing Medicaid and being less likely to engage as a member of the democratic polity. And it made perfect sense. I mean, people explained it to me in really explicit terms, like what they're experiencing when they encounter policies like Medicaid shapes how they think about themselves, whether or not their voice matters, whether they can have any sort of impact in terms of the kinds of health resources that they have access to, and so on and so forth. And so, of course, after you have those experiences with institutions and agencies like Medicaid, why go out and vote? Why go out and participate in your community? Why go out and try to find ways of expressing your voice? It's already been made clear to you that doesn't matter. And one of the things I paid attention to in the book is when that looks different, when people are in, when power is built successfully and people are channeling power to try to create change. And so, that's sort of where those ideas came from. And one of the things that's really stood out to me since that work has come out is how many Medicaid beneficiaries will send me a message or an email and say, this is the first time that I read something where we are, portrayed as active, agentic, like power holding people, right? Who ought to have a voice in the processes that are affecting our lives. And I think that this is why power keeps emerging in the conversation. You don't really get to justice as far as the process or pathway there. You don't get there without folks who are on the margins, whose lives and whose well-being are at stake, without them having a voice, a say, and an influence. You just don't. Justice isn't something that emerges out of the good-natured or good-heartedness of folks who have all the resources and all the advantage, right? And not to say that there aren't economic and political elites out there who have good in their hearts, right? But that doesn't get us to justice, right? It doesn't come without demand and without pressure and without deep engagement from people who have the most at stake. And so power has to always be a part of the conversation when we talk about justice.
Thank you. If you see me looking down, I am taking notes and making sure that I can quote people as these words of wisdom are given today. Charlene, I want to turn to you. We want to turn to hear more about your blog post. And so your blog post introduces a framework that might be new to some of our readers, but that you've explored in your broader body of work. Can you say a little bit about the meaning of community justice and how you see it relating to health justice?
Be happy to. Great. So a few years ago, I started working on an alternative framework around justice, partly because I was reading theories of justice and trying to find communities. What part did communities play around justice? And by and large, they weren't there. And when they were often there in one of two negative ways. One was that they were seen as obstacles to justice. So particularly religious communities, for example, who had their own notions of justice, were seen as obstacles to a supposed, secular, neutral idea of justice, supposed anyway. Or they were seen as just impotent. And often that was communities of color and gendered communities. They just didn't have a role to play. They weren't powerful. And I knew this wasn't right. I mean, there are many other ways that communities have been powerful and that we need to think about in terms of justice. So I started working on a framework called community justice, which is both an attempt to clear the ground theoretically, to try and create space for communities. And it's anchored on the idea that health and healthcare are social goods at multiple levels. So they're a social good at the global level, at the national level, but also at the level of communities. But we often don't talk about that. And so this framework attempts to take seriously what those communities think justice is. And it's embedded within a notion, like all those levels of justice are related to one another. So community justice would be embedded in the work that we would do around a national sort of notion of health justice. And like Jamila was talking about, like the Medicaid program, for example, how would we bring communities into a very national? Well, in fact, states are in a different way, but and so it's an attempt to give space for communities to have their voice, to build their voice, but also within certain parameters. And so you couldn't have a community that could just decide they weren't going to offer healthcare for certain people or something like that. So there's three sorts of moral norms, if you will, in this idea of community justice. And one is, who is the just community? And I suggest it's everyone is in one way or another. Everyone has to be in the community. Just care, which means that we look at not just healthcare of sick people, right? But we look at the wellness of well people. Like we try and think about public health, for example. So all those social determinants of health that are relevant to keeping people healthy. And then just participation is something I just call effective voice. You know, what does it mean to build effective voice? And to figure out, really importantly, how multiple and different communities who have different ideas work together. Because we aren't just members of one community, right? So how do we bring together and discern the kinds of values and meanings that we want to have embedded, and particularly communities who have been most affected by the lacks in our healthcare and public health systems? How do we enable the kind of conversations that need to be had so that there can be enough agreement to establish healthcare and public health systems and institutions around that? And I think, so in relation to health justice, I think community justice kind of needs to be a part of health justice, however that's framed, if it's largely at the national level.
You know, Charlene, something that sparked for me is actually a piece that Angela and I had previously written for a Bill of Health. And it relates to what you were saying about social goods, you know, and what the very contested nature of what should and shouldn't be a social good, and the conversations we're having, and what we're really saying when we're having those types of conversations, and some of the buried notions underneath that about how there's deserving folks and undeserving folks, and we really need to protect, you know, public goods from undeserving folks getting access, which is, of course, an incredibly racialized concept. But one of the things that Angela and I dug into that you really made me think of is how moments of disaster or crisis, COVID is certainly one, our racial reckoning is certainly one, you know, the uneven economic recovery is another. But these moments of disaster are what we talked about as wet cement moments, where what is considered a social good and what isn't is temporarily malleable. And in that moment of opportunity, things can change for the better or for the worse. I think the examples we looked at was, you know, the privatization of the energy grid in Puerto Rico after Hurricane Maria, the privatization of the school system in New Orleans after Hurricane Katrina. And so what you really made me think of is, in this moment that we're in, this wet cement moment, let's say, what are the opportunities to really push the envelope in towards health justice in terms of, you know, what we classify as social goods?
I love that line, a wet cement moment.
If I can I just jump in on what Aisha just said, because it's also making me think about some of the other work that I do is around climate change. And there's a vibrant climate justice movement as well. And part of what folks are thinking about are how do we control at the community level, to kind of weave together what Charlene's talking about with what Aisha is talking about. How do we weave together those two things and think about control of things like energy grids? What if we decentralized our energy systems, and rather than having it be a national system, what if we considered community ownership of energy generation rather than privatized ownership? Same thing with water systems. There's a huge debate now around water as climate change, climate chaos is ongoing and really destabilizing access to clean water. Are there questions about community control of water systems and community management and governance of water systems that seem like a whole, you know, a technical thing over there that doesn't matter, but it's really central to health. And it really, I think, raises all these questions that you all are talking about, you know, how do people have build that connection between their personal health, their sense of empowerment as citizens, their democratic participation in their communities, and their ability to affect these and control these very basic public goods that are necessary to human life and flourishing.
I'd love to invite Aisha and Angela to also bring in the topic of their post for this symposium, which is the criminal law system, or we often call it the criminal justice system, but it's a fairly ironic label to use. You have this beautiful line in your post: a health justice perspective invites us to imagine a far more robust set of institutions in service of community security, and pushes us to prioritize science rather than punitive morality in designing them. And you tie this to the movement to defund the police. That we're talking now about this moment, this wet concrete moment, and the criminal justice reform movement to really radically rethink policing and criminal justice in this country is certainly part of this moment. So I'd love to invite you to say a little more about that connection.
Angela, do you want to start?
Well, okay, I can start and you can jump in. How about that? So one of the other hats that I wear in law school is as a teacher of first-year criminal law. And criminal law as a 1L course for our first-year law students is really we teach about bad acts and guilty minds. So it's 100% focused on the individual who has committed this crime, and we have to figure out what they did and what kind of state of mind they did it with. And that means, if they committed the bad act and they had the guilty mind, then they go to jail, they go to prison, and the problem is solved. And the call of Black Lives Matter, the movement for Black lives, to defund the police really destabilizes that story of crime is about bad people, and we have the police, and the police catch the bad people and they put them in prison. Defunding the police really opens up the space, I think, for us as a culture to say, wait a minute, why is it that we give complex social problems like poverty, homelessness, mental illness, addiction, we give them to the police as if it's a question of order, keeping order by sweeping these unruly people off the streets who have committed harm, when we know from public health research, we know from community activism that the problems are much more complex than that, and they ought to be addressed upstream in a preventative way, rather than this sort of punitive, morality-focused, individualistic way. So the call to defund the police has really thrown a lot of panic into people, because they think, oh my God, what if there's no public safety? But we see it as a really powerful call to rethink, what are the police for anyway? And are there better ways of creating actual public community security and safety than trying to find bad people at the end of these very long chains of harm, institutional harm and individual harm, and just throwing the bad apples into prison. Aisha, do you want to say more?
That's beautiful. That's exactly why I invited you to go first. The only thing I'll add to that is that we really position the policy and budgetary possibilities of defund the police as originating in the imagination, right? Because you can't legislate and you can't budget what you can't imagine. And what defund the police has done in the tradition of social movements before it is it has expanded what Angela Glover Blackwell would call our radical imagination, and allowed us to envision social solutions to our problems that we previously couldn't have even imagined. And that also has invited us to imagine new folks who are participating in that solution, who weren't previously at the table. So it's really that expansion of our collective imagination that is the precursor to the policy and budget reform that we've talked about. And so I think it can't be overstated how much this originates in the heart, to your point, Shanila, about the connection to love. And so, it's not just a heady concept, right? It comes from the heart and the imaginative space. And then that in turn is what our lawmakers, what our court systems act on. And I very much believe it is in that order and not the other way around.
Yeah. I just feel compelled to jump in just for a moment and say that imaginative process, for me, that was such a powerful thing about a public health education. that, the best of the public health tradition is to work to examine our biases in terms of our need to see things as matters of individual bad actors, right? And to instead examine the whole world of possibilities of social and ecological factors and design in the built environment, and think about all of the different sites for intervention other than blaming and shaming and punishing individuals. And we have not seen the public health tradition always live up to that historically, but it's a powerful imaginative prompt in my mind that comes from the public health orientation.
I was gonna, I think that's right. I was gonna jump in and say, it's really interesting how we all, even though like it's not like we all know each other super, super well. Some of us have different connections or what have you, and we know of each other, but it's not like we got together before this and said, here's what the message is going to be, right? It was very much like, let's get in a Zoom room and talk and see what comes from it. And so I love the synergies that clearly emerge. And even in the blog symposium piece the piece that I wrote for the blog symposium around this, I talked about freedom dreaming, and that really drew on Robin D.G. Kelley. And in the piece, I pointed out this great line that Kelley has. It says, the map to a new world is in the imagination, and what we see in our third eyes rather than what we see in the desolation that surrounds us. Being able to look around you and think about possibilities beyond what it is that you see, based on a kind of radical imagining that allows you to think about a world that looks dramatically different than the world that we live in now. And so what, I think Angela so aptly described in terms of the approach of that 1L criminal law class, and that really is about what is, right? And when we think about other kinds of approaches around abolition or whatever you might call it, those approaches are really grounded in what could be, what should be, what ought to be, right? And that is about imagination. And it's the beginning point for thinking about how we're going to channel politics, how we're going to channel power, how we're going to channel policy, so that it gets us towards those ends, right? But if we don't at least allow ourselves to think in those terms, we can just reinforce the status quo with little tiny marginal shifts. And the marginal shifts will feel like such huge victories because that's what serves the kind of continuation of the status quo. And that's not to say that marginal shifts don't often matter for the stuff of people's material lives, but they're a beginning rather than an end. And to sort of really reach towards more transformative ends, it takes quite a bit of imagination. And it's challenging in the context of, for example, academia and being researchers, whether it's in the public health field or the legal field or social sciences. We are not taught to think in imaginative ways, right? And so there's a kind of unlearning of the strictures that are often placed on us as we're professionalized and disciplined in various ways professionally. And for me, one of the things that allows me to sort of break out of those strictures is consistent connection with people who are not in this limited space, right? Who aren't academics, who are the folks who the work is really about, is really for, is really thinking towards. And so anyway, it just struck me that there are some threads here that are so beautifully synergistic without us even really planning it to be so.
If I can just add to that, you all are amazing. This is a great thread. I too have had imagination in some of my writing and about the importance of that. And I want to also just say how important I think it is that we claim it as moral imagination as well, that it is about justice, it is about respect, it is about love. Because what I find in some of my students is, because the morality conversations or language or discourse has always been so punitive, right, and so oppressive, they want to give that up and go to the science, for example. But we know the science too can be deformed in a number of ways and has been oppressive at times as well. So I think it's really important to affirm justice, as moral imagination as well.
And I just want to jump in to say that to me, sometimes transformation and imagination can be scary, but it's about the possibility, right? The possibility to achieve something even greater. And so with that, let's wrap up. I want to ask the panelists to reflect on what it's like to do health justice work in this moment, and how can health justice scholars, researchers, advocates, and communities support each other at this critical time. And feel free to jump in. Angela, because nobody's jumping in. Oh,
I can venture at least a first thought that really hits at one of the themes in Angela's work and scholarship and in our collaboration on the civil rights of health is just really close collaboration as equal partners with social movements for justice. And, again, making sure that marginalized communities are not the targets of our policy. They're not even the targets of our charitable efforts, but that they too are co-creating the solutions alongside of us. I think that is exactly the invitation that's open in health justice. And I think that's what the work really calls me, and I think many of us, to do. So for me, that's really the headline of this really complex and rich work.
Yeah, I couldn't have put it better myself. I mean, in this moment, what it feels like to be working in the health justice space, honestly, is it feels like a really urgent and heavy responsibility in many ways, right? To have a voice, to be on a panel where there are how many ever people watching, and to be writing things that people will read, and to be trying to craft ideas and build an evidence base that could potentially be used. There's a real responsibility there, and it's not one that I take for granted. And I do think the process matters, right? So for me, it's not about more papers on the CV or more talks or more people listening to me just so I can have whatever, I don't know, whatever achievement one would care about if they're thinking about it from a kind of self-oriented perspective. But I think the responsibility that many of us have in this moment is to remain grounded to the people and the motivations that kind of underlie this work, and make it meaningful and important, and to be willing to be accountable, both to other scholars and thinkers, but also to people and to communities, and to the potential impact that our choices around language, around evidence and such can have. And so I think that's a lot. But it's important for us to understand that even the kinds of attention or influence that we may have, to the extent that we have any, is something to be, I think, to be redirected, if anything, towards to create space for others, right? And not just be trying to take up the maximal space ourselves. I'm always pushing myself to think about how my work is creating more space for more equitable and transformative inclusion of more people who have different and important perspectives. And that I find that's a high and challenging bar, but I think it's one that this moment, and honestly, all the moments before this, have called for.
So I would just say yes, yes. I'm not sure how much more I have to add to that, except perhaps to say some things in some different language, which it feels like making time to connect, making time to build those relationships and build trustworthy relationships feels really important. Coalition building. I find myself in academia also needing to remind myself and my students around not privileging the sort of epistemic privilege, right, of academia, as you said, Jamila, like getting outside and being connected to people who aren't in this space. Thank you all so much.
Yeah, I'll just pipe in and say thank you for putting this conversation together. This has been really incredible. And I want to echo what other folks have said, like this, it's this beautiful coming together of folks who didn't necessarily know each other beforehand, but I feel like we're all moving on these converging tracks and really weaving in these themes of imagination and love and empowerment into all of our work. And it's really inspiring. Thank you.
The time has flown by. I want to thank all of our panelists for their words of wisdom and their engagement and love with which they are approaching this important work. I want to thank Chloe and Laura and Glenn at Petrie-Flom for creating the platform for us to have this conversation and for the symposium that this event has been part of. I want to thank all of our blog contributors, and those blog posts are going to continue to be shared and promoted in the weeks to come. We're really excited. Rakai and I are so excited about the fantastic individuals whose work we're able to feature through this initiative. So thank you all for joining us, and we'll continue to do this work in as many forums as possible while it's not possible for us to be safely together, gathering from across the country and the world.
Thank you.